Good morning, ladies and gentlemen. Please allow me to share my personal experience or personal perspective being a former migrant worker. I'm Owi Franco from the Philippines, a former migrant worker based in Saudi Arabia. As I'm working as a private waiter, I had to undergo the medical test. Every time I renew my work permit, or I was not aware that also tested me for HIV. My medical test result was directly given to my employer. The lead assistant of my employer told me that I need to go back to the hospital. I was accompanied by two co-workers at the hospital. The doctor told me that I was HIV positive. I asked the doctor to give me the result of my test, but she did not give my test result. She just told me that I was lucky because I was brought in a hospital and not to a prison. I was detained in a small room in a hospital for 2 weeks. Migrant workers are vulnerable to HIV infection because we don't have enough information. Most of us feel homesick, and to cope with this, we have a relationship abroad and engage in unprotected sex. In some countries, migrant workers are forced to have sex with employers, get raped and violated. Lastly, because of cultural language barrier, we are victims of unfair treatment. I felt my right was violated. I was tested for HIV without my knowledge. There was no counseling before and after the test. And I was not informed immediately about my status, the result of my test directly to my employer. As a volunteer and a member of support group of people living with HIV, I've met a lot of former migrant workers who also experienced an injustice. In Dubai, 5 Filipino workers were detained for 2 weeks. They were not given any information why were detained. Overseas Filipino workers work in Singapore as a medical staff. Was diagnosed with HIV, he was deported back to the Philippines. I also meet former migrant workers from Taiwan. She has been working there for several years. After a routine medical test for renewing her contract, she was asked not to leave apartment where she has been staying. She was locked inside the room and for several years. Most of the time, contract migrant workers are not followed in other countries. Like me, I signed a contract prior to our departure. I received much lower salary than one stated in our contract. When the doctor told me my status, I was hysterical. I was crying not because of my status, but because I was not told that would not be able to work anymore. There were no counseling services in the hospital where I was detained. I had no one to talk to or listen to. While in detention, I was not given a chance to get my things from my place of employment. My employer did not contact me. Migrant workers are terminated due to their status, have no opportunity to get their benefits such as separation fee or health benefits from their employers. While I was detained, I had no access to legal and social support. Female migrant workers are also deported if they get pregnant out of wedlock. The biggest burden of migrant workers when diagnosed with HIV on site is termination from work. My experience was horrific. It took a while for me to get over what happened. I thought I feel only the Filipino who is living in the virus. I did not inform anyone about my status for being detained again. After I was deported back to my country, I got a job. I ignore my HIV status. I work as if I'm not infected. One day, I get sick and I found an NGO, non-government organization, based in my hometown. After I talked with them, they referred me to Pinoy Plus Association, a support group of people living with HIV. The president of the support group accompanied me to get my confirmatory test. After the meeting, the support group, I was encouraged to face my status and be empowered. I disclosed my status to my family, and we faced the media in 2008 in the Philippines. I believe I believe to do what happened to me and to other migrant workers to ever happen again. It would help to ensure the public health authority are empowered to provide effective in prevention and in treatment program both in country and across international borders. It's needed to effectuate the human rights to life, health, work, education, and property ownership of persons living with HIV and AIDS, disseminate information and education, not only for the migrant workers, for all the Filipino living with working abroad. The inter-country cooperation and partnership should be strengthened to avoid injustice in the receiving country. HIV services in other countries should be also available and accessible to migrant workers. It should be a consistent and with scientific and public health practices and with human rights framework. I hope that with the story I shared, you will understand the situation of migrant workers who were detained like me. I would like to call on the government and destination of countries to remove all mandatory HIV testing. Being HIV positive does not mean that we should not be detained, that we should not be terminated from work, that we should not be deported. People living with HIV and AIDS are human beings with the same set of rights and responsibilities. We still have the right to work, right to be free from stigma and discrimination. That's all. Thank you.